This project took me a little bit out of my usual element in including health literacy measures, and also it's a correlational design rather than an experimental design. The general problem that led me to this area of research is that health researchers and providers need to know about the language proficiency of participants and patients. And actually, there are a number of other types of researchers that also need to know about the language proficiency of the participants. And we need to know whether measures administered in English will be valid for non-native speakers, and we need to know whether patients can benefit from English language services. So current methods to determine language proficiency and dominance in non-native English speakers are not adequate. Standardized tests exist, but they take too long and require extensive training. It can also be the case that testing could be objectionable to participants or patients. And self-report measures may not be predictive of actual proficiency or literacy. So we need to find out whether there's a combination of self-report measures that would lead to reasonable predictions of language proficiency and health literacy. So in the present study, we begin to address this issue by testing how well self-reported language proficiency and background information would predict performance on standardized tests of language proficiency and measures of health literacy. The study is ongoing. At this point, we only have 32 participants, but we plan to expand this substantially. And these are UTEP students with a median age of 22 years. All were of Hispanic ethnicity. And the first language was Spanish for 81% and English for 19% of the participants. The procedure had three main components. The first was a language questionnaire, which I'll tell you more about in a minute. The second was a language proficiency assessment. And for this, we used the Woodcock-Munoz Language Survey Revised in English and Spanish. We used the brief form to get measures of broad English ability and broad Spanish ability. And additionally, we used the text passage comprehension subtest. For health literacy assessment, we used two measures. One is the Rapid Estimate of Adult Literacy in Medicine, or the REALM English version. And this one is one where participants read a sequence of progressively more difficult medical terms. The other test we used was the test of functional health literacy in adults, or the TOEFL, and this was the English version. And in this test, there's a section on reading comprehension, and there's a section on numeracy. In the questionnaire, we had an extensive number of questions, so I'm not going to talk about all of them, but I'm going to talk about a few general variables and focus on those. So the first is relative language proficiency, according to self-report. So we had participants rate their relative proficiency in English and Spanish for speaking, listening, reading, and writing. And we used a labeled scale going from 1 being only speaking English to 9 being only speaking Spanish. A 5 would indicate equal proficiency in the two languages. And we averaged together the ratings for the 4 different components of language and got the final score. We also had a new way of looking at language proficiency by having them do performance estimates. So we told participants, if the average native monolingual English speaker scores 90% on the test, what do you think you would score? And we asked this for speaking, listening, reading, writing, pronunciation, spelling, vocabulary, and grammar in English and in Spanish. And we estimated usage of English and Spanish based on self-reports of usage of the two languages in speaking, listening, reading, and writing, and we averaged those percentages together. And finally, we derived the years of experience with English by taking the age of the participant and subtracting the age of acquisition of English. As you can see, we could also focus on just the reading and writing components, which is an analysis that we'll do in the future. For now, keeping it general. Okay. On the key self-report variables, the average rating of relative language proficiency was 4.5, which is slightly toward the English dominant side of the scale. People's average rating of their English proficiency, English performance relative to a 90% average was 84, and for Spanish it was 79. And so both of these are lower than the 90%, and this also suggests English dominance in this sample. And then the usage of English over the last month was reported as 65%, usage of Spanish 29%, and the remaining 6% would be mixed English and Spanish. Also, on average, the participants had 16 years of experience with English, so this is, so they're pretty proficient. On the key measured variables, broad English ability and broad Spanish ability had age equivalency scores. So the age equivalency scores were 24 and 24.2, 23.5 as the average age equivalency. Reading comprehension subtests in English and Spanish had scores of 23.8 and 23.5 respectively. The scores on the realm health literacy measure were very high, 64.4. We kind of had a ceiling effect on this one. We didn't have very much variability, but we had a lot more variability on the TOEFL, and the average score there was 92. So still, it was within an adequate range, adequate proficiency or adequate literacy, but there was some variability there. Okay, so this first slide shows the first thing that we looked at was prediction of standardized language proficiency scores based on self-report measures. And what's shown here in the table are the zero-order correlation coefficients of each predictor with the English language proficiency test and the Spanish language proficiency test. And then at the bottom is an R-squared value for the proportion of variance explained in a regression model that contains all 6 of these predictors. So some of the correlations are quite high, in fact, especially in predicting Spanish language performance. And this kind of makes sense because we had more English dominant participants, so there was more variability in actual Spanish proficiency and, not surprisingly, more variability in the prediction of that proficiency. Okay, so we were able to explain 47% of the variance in the English language proficiency and 69% of the variance in Spanish language proficiency. We also looked at how well those self-report measures would predict performance on the health literacy measures, and together they explained 55% of the variance in the realm and 36% of the variance on the TOEFL. So it did better at predicting the realm than the TOEFL. And a large part of this is this correlation here. Then next, we looked at prediction of the health literacy scores. I was wondering whether the language proficiency measures would actually correlate with the health literacy scores. They should. And we found that the realm, they didn't correlate very highly with the realm, but they did correlate, especially the Spanish reading comprehension score correlated very highly with the TOEFL. So to summarize the R-squared values and predicting health literacy scores, if we look at just the self-reported predictors, We explain 55% of the variance in the realm and 36% in the TOEFL. And with measured language predictors, we have 38% and 87%. And if we combine both sets of predictors, we get 73% and 93%, which is nice, except that we don't want to have to give people the language proficiency test every time we want to estimate health literacy. So we'll see what happens when we add in additional predictors. Now, what the conceptual model of what I'd like to be able to do with this in the future is to have a set of self-report variables, which may include proficiency ratings, years of experience with English, recent usage of English, and education, which we couldn't look at here because we had a university sample. And there may be other variables as well. And then these would predict language proficiency, which would be indicated by performance on the English language Woodcock-Munoz language survey. And then language proficiency and education would be used to predict health literacy in English. And health literacy can be indicated by the realm and by the TOEFL. And so this is sort of the way I'm thinking about the problem. Some limitations of the study is that one thing is that we had insufficient representation of Spanish dominant participants. We didn't have enough variability in English proficiency, and so in the future, as we continue this project, I want to recruit students from ESOL classes. And another limitation is that we used a university sample, and in the future, I'd like to get a community sample to get a wider range of educational levels so we can see the role of education. And that's it.